Hi, my name is Marta Pires. I'm a chartered psychologist, accredited as clinical psychologist and counseling psychologist. I'm also an EMDR therapist and a deep memory process therapist. I work at private therapy clinic where you can find me in London or via Zoom. The approach that I use is an integrative approach in which I have in my toolbox EMDR, which is wonderful for any sort of trauma, especially PTSD symptoms. But I use it with all sorts of issues. I also have a dynamic approach. I can use some CBT informed therapy and DBT informed therapy to help emotion regulate. And I have animal assisted therapy in my practice, which means that I will be having a dog in the room. You'll be having an unconditional source of love, and normally a therapist wouldn't touch, wouldn't hug, wouldn't show love to a client, but the dog will come, and the dog tends to develop a unique relationship with every patient. Will come, will greet you, might sit next to you, or might sit on your feet, depending on what you want and what you feel comfortable, and might give you some added emotional support through the session. It is an added bonus to therapy. I used to have this is my second therapy dog. My previous therapy dog, when it went into retirement, some of my patients said, Marta, I love your therapy, but it was much better when we had the dog. So it does add a factor. In itself, I work with children, I work with adolescents, and I work with adults. So I work to full range. I work with parents. I work also with couples. Uh, I work with almost everything. So trauma, relationship issues, anxiety, phobias, addictions, codependency. Just if you're feeling stuck in your life and feeling a little bit low and you don't quite know where to go or where you are. Uh, some people use therapy and I can help them as I call it as if you were an Olympic athlete. So therapy can be used if you've broken your leg and you're using a cast, so you're severely depressed or you have a severe phobia or severe anxieties, and it takes a longer time to heal. It can be used when you no longer have that cast and you're walking and just say, let's say you want to start jogging, can help you start that jogging and start new patterns in your life, new relationships. But it can also be used as an Olympic athlete. So you're already very functional in your life, but you add therapy as a surplus. So when someone comes to see me or is thinking about therapy, we offer the option of having a quick call with me, a 10 to 15-minute call where you can ask me more questions about my approach or more questions about the how we do therapy. But in my process, I like to think of the first session where you experience what it's like to do therapy with me. And I feel that it's essential for any patient to feel comfortable with their therapist because I can be exceptionally good and I'm very good, but you are the expert on yourself. And part of the therapy results have to do with you feeling rapport and comfortable with your therapist. So I would say first session is about you coming to me, letting me know why you're here, what are your goals, setting expectations, and me letting you know, yes, this is what we can do. And you also having the option of saying, Marta, I would like to do a few more sessions with you or like to start this work with you. Or Marta, I can say to you, go and have interviews, first sessions with our therapist, and then decide who do you have most rapport with. So I would say that first session is for that. Normally within the first session, we also set or curate what your therapy is going to look like. So we talk about frequency of sessions and we can accommodate to the needs of the patient. So if you're going through some financial difficulties or you're not able to accommodate once a week sessions, we can think about every other week sessions, or we can think, depending on the needs where you are, we might need twice a week sessions if you're able to do that. But we, at every point through the therapeutic process, we will change the needs of frequency depending on where you are. And we'll always talk about it. So I think that's what we expect from the beginning from a first session. And of course, if you're having a face-to-face session, you'll be meeting Chloe Lily Bear, the therapy dog. I would say that actually it's usual for people to have challenges in life. Every phase of life might give you different triggers and different challenges. So, let's say if you have a breakup, if you have a big loss in your life, if you just have a child, if there are some changes at work, those can lead to temporary psychological difficulties. So you might have people that have long-standing trauma that comes from their childhood, and we might need to go there and work with that trauma to help them where they are now. And then you might have people that are highly functional, but due circumstances of life and stresses of life, they need some extra support. So it's actually quite common, I would say, to go, and as I said, the use of the therapist or the psychologist, not only as you have a broken leg, but hey, I'm an Olympic athlete and I'm not able to run anymore. What's happening with my life? Is it that I am a little bit low and I'm neglecting my needs? Is it that I'm getting too angry because I'm not able to communicate or identify what I'm not meeting in my life? And I need a space for me. So I would say that it's quite common for people to go through different stages in life and having some challenges or psychological difficulties. I think a good quality of a practitioner is to be able to meet the client needs and to achieve results. And actually, one of my favorite things of what I do is to help people change their lives and change how they know themselves, how they take care of themselves. And that for me is the biggest reward of what I do and why I do it. And I think that's one of the best qualities. You need to be able to listen, to empathize, to tune in, because everyone is unique and everyone is different. And to be able to use the set of tools that we all have, that I have in my toolbox, at the right time to support and help that person achieve their dreams and their goals. So that's what I do, I think. I've had my own personal therapy. So, as a practitioner, I find that it's very important that uh, I have experience and I've gone through therapy. I've experienced several modalities of therapy. I've experienced psychodynamic, I've experienced psychoanalysis, I've experienced regression work, I've experienced EMDR. Um, I feel that therapy is wonderful, and especially if it's my line of work, it's also something that I need to care for myself and lead by example to my patients, how they also are learning how to care for themselves.